We'll talk more about it right now with Dr. Tom Price, who joins us, the former HHS secretary. Your view, Dr. Price, on what HHS did today in terms of these recommendations, which should, as the states follow through on it, make the vaccine available to a wider number of people as we roll it out. What did you think of that?
Well, thanks, Connell. Good to be with you. I think it's imperative that we get this vaccine out as rapidly as possible. And we've talked about the fact that it's the states that are responsible, the infrastructure in the states that are responsible for delivering the vaccine, getting the vaccine in people's arms. But nothing could be more important at this stage of this disease, especially with this recent spike that we've had, than getting folks vaccinated. And getting those folks vaccinated that are at greatest risk over the age of 65, and then those under the age of 65, but with comorbidities, is incredibly important. But the more, the better. And so the more we can do to get that message out, to encourage people and have people recognize that this vaccine is a safe vaccine. There isn't any reason not to take this vaccine.
All right. And what about the risk of, instead of holding back the second dose, putting that out there as well? President-elect Biden had called for that to happen. Now Secretary Azar, before the Trump administration leaves, is apparently going forward with that plan as well. Is there a risk there, or do you think that's the right move?
Well, the only challenge there is that if the production isn't enough and the distribution isn't enough to be able to be timely in giving folks the second dose if they've already had a first dose. But there's a greater window likely to provide that second dose. In the EU, they're recommending up to 90 days can be provided. So I think that the production and the distribution ought to be able to catch up with that. But goodness knows we're not moving as rapidly as we must.
No, we're not. We have to pick that up. And to that point, as a former congressman, what would you say about the potential economic impact? When you're in the Congress, you would get asked those types of questions, connecting health policy, you're a medical doctor, with economic policy. I know I interviewed Raphael Bostic, who's the president of the Atlanta Federal Reserve, when I was in Atlanta last week. And he said if the vaccine rolls out, the economy will get rolling pretty well also. But that's the caveat, because to your earlier point, we need to pick this up, right?
Yes, absolutely. The numbers need to be significantly greater. Remember, we've got to have about 70 to 80% of the population having immunity either through vaccine or having had the disease. We prefer it to be through the vaccine. So that means hundreds of millions of individuals need to be vaccinated. And we're just not on that path right now. And so if we're going to get there within the second quarter, by the end of the second quarter of this year, then we've really got to increase our ability to get these vaccines in people's arms. So all that we can do to make that happen will improve the economy. Imagine, if you would, the confidence that you would feel, or anybody would feel, if we've got 80% of the population with immunity and knowing that there's not a possibility of the disease to have this kind of spike like we're currently having.
Do we need a stronger national approach to have that happen? I know, conservatives, and you're one, have said that this should be something that is passed on to the states. That's what the Trump administration has essentially done. Do you expect the Biden administration to take a more of a kind of a national approach? And if so, is that what could help in this particular situation? What are your views?
Well, the public health system in this country is set up through the states and through the local communities, and that's not going to change, nor do I believe it should change. But what must happen from a federal standpoint, it's not that you're hands off. It's that you unify with a single message that is delivered repeatedly over and over about the imperative and the importance of getting this vaccination so that we're able to move our society forward. We're able to get back to the kinds of things that all of us want. I watched the game last night, the college championship, and it was wonderful to see that. However, wouldn't it have been much greater to have that stadium full? And the only way you get that stadium full again is to have the confidence that that number of individuals can congregate together that have immunity in order to be able to do the kinds of things that we did before. That's true for every sector of the economy.
I'm sure Alabama fans agree with you. That was some performance. Dr. Price, thank you. It's good to see you again, and we'll talk to you again soon.